statewide orientation and mobility consultant at Texas School for the Blind and Visually Impaired. He also presently is serving as the chair of AER Orientation and Mobility Division and a subject matter expert for ACVRP in the area of O&M. His interests include all things O&M, expanded core curriculum, and technology. He's worked as an itinerant at residential settings and as private practice contractor with adults, school age, and early childhood learners. So welcome, Chris.
Thank you very much, Becky. And just one correction, since that was written, I'm no longer the current chair of the O&M division. I'm the past chair of the O&M division.
Okay.
Joanne Challam is our current chair, but I sure appreciate that. Thank you. I have a favor to ask, knowing that Miss Deanna is going to go immediately following me. If somebody could give me a thunk on the head, let's say 5 minutes before I'm supposed to transition, that would be great.
Okay.
And for every. Thank you, Becky. For everyone joining, I may not be paying attention too much to the chat, but if you have questions, hopefully I'll jump over there, or maybe one of the whoever's monitoring can remind me of that as well, but I'll try to keep an eye on that.
I'm sorry, Chris, I need to interrupt Jerry. I forgot again. For the evaluations, we need an opening code and a closing code. So the opening code is, I lost it. Give me a moment.
Live, capital L-I-V-E.
Thank you. Yes, live.
Thank you. Okay, so maybe just to get a sense as we get started here, if you could put in the chat whether you've looked at or used the LiveBinders before, that would really help. I'm hoping that we get it won't be redundant for everyone. So. Let's see, I'm going to watch the chat, and we got some yeses, we got some nos. All right, well, we got a good combination. So I apologize if this is redundant for anyone. I'm going to go ahead and do a little zoom through to show everybody what's there. Start sharing the screen here. And jump over and jump over to LiveBinders, and let me see if I can get the chat. I don't know if I can view the chat at the same time, so I'm hoping that you all are seeing the screen here. These LiveBinders, let me see if I can, there we go. Okay, the LiveBinders are available for anyone to use. They are free. You can share them with other professionals, you can share them with families, and you can also make your own LiveBinders. At the base level, it's free to use. You can make simple binders. There is an educator's rate to have an account. And what that does is it gives you a little more storage for binders, it gives you a few more options when you create the binders. But they're a terrific way to share resources. If you're working with school age, for instance, with a team, or even adults, if you have a team of folks, it helps to keep everybody on the same page. You can make them private so that only certain people see them, so that if there are things like videos of students or adults, any learner, then you can keep that just to those that are paying attention to that particular learner. So I'm going to start with just some of those that have been used the most. Let me see if put the link for the binders in the chat there. And so it's http://bit.ly/LiveBinderOM, and the L in live and the B in the binder and OM have to be capitalized. It is case specific for this particular page. You can also search by author on LiveBinders to find these, or email me. So I'm going to go ahead and open this first one. The one that seems to be the most popular, that these two at the beginning here, the expanded core curriculum resources, as well as the paperwork basics, are the ones that people seem to go back to the most. Within the expanded core, there's a section for each, just a little description of what the binder is. There's a section for each area of the expanded core curriculum. And I didn't make these resources. There's a couple of things in there that maybe I did, but most of these are just culled from all over the world, from orientation mobility specialists, other professions that relate to all 9 areas of the expanded core curriculum. I'm going to go ahead and open up a couple here. So there's general expanded core resources. Some of these are very big. I don't know that you'd want to print them. So for instance, in Iowa, they have the expanded core curriculum resource guide. This is several hundred pages. It's a terrific resource that you can go in and download. Some items in the LiveBinders are PDFs, and they can be downloaded directly. By clicking the link above, it would allow you to do certain things. It could open it in a new tab, and from there, depending on your browser, you could download it to your own computer. If something doesn't launch, just clicking the URL above it will allow you to have access to it. So lots of different general ECC resources here. There's ways to explain the ECC to families and to other colleagues. Many times when we go into schools, or if working with adults, other related fields aren't aware of what the expanded core curriculum is, and these can be very helpful in explaining what they are. I'm going to jump to some of the areas of the ECC. We've got assistive technology, lots of resources here from other places, such as Paths to Literacy. Sometimes the websites themselves will not allow the page to be displayed in LiveBinders. Sometimes it's LiveBinders has changed. And so I'm not good enough at keeping up with it all the time, but just so that you know, if the page itself doesn't launch or you see a sad face icon in here, you can just click the link. It will launch that individual web page. So that you can go and investigate there. This is Paths to Technology, a terrific resource for assistive technology. And you can find resources that are specific to orientation mobility. That's something from Diane Bronner. Again, lots and lots of resources. Career education, other resources from AFB, from Perkins, lots of different places, even those that are not necessarily related to visual impairment and blindness, but they can be terrific resources in working with your young adults to be able to transition into adult life. Again, all of these resources are just available on the internet. They're free. Feel free to download them, copy them, share them. The reason that these are called LiveBinders is because it would bring in a live page from wherever that particular location was, so that if their page updates, it would bring in the new information. Lots and lots of different resources here for each area of the ECC. In terms of orientation mobility, again, lots and lots of resources. These are just places to get started. It's certainly not everything that's available on the internet, but it's hopefully a place to have a collection of things when you need something in a pinch to go and grab it. I'm going to go back to the binders for just a moment, and we'll go over some more. There's about 40 binders. They're all related to orientation and mobility, visual impairment and blindness. There are things that can be used by a TVI or TSBVI, depending on where you're from, or certainly orientation mobility specialists. There are some families who want to be able to jump into some of these things. There's one binder that we'll get to that's specifically targeted at parents and families. But for the most part, these are professional resources. There might be something that would be a little bit overwhelming to families, but you can kind of walk them through that and direct them to it. If you want to share just one binder rather than having all the binders, I'm going to go back to most viewed, you can specifically share just the link for that. So if you hover, it will bring up the options. And then from the options, you can choose share this live binder. It would provide you with a link to that one specific binder. So if you feel that you're working with folks that this would be overwhelming amount of information, you can kind of tailor it a little bit just to suit their needs. Or you can just pick out one of the resources and send that to them directly. Paperworks Basics. These binders, for the most part, were built from people asking questions, and rather than repeating the answer multiple times, it just was easier to build a tool that would allow people to have resources to these things. These are all resources that come again from across the world. There are evaluation tools, there are guidelines and standards. Ron has produced some from Mexico, Mary Tellefson. Lots and lots of people have created these things over the years. Tanny Anthony, they're just available here without having to go hunt for them. So we've got guidelines and standards. We've got evaluation tools with, I'm just going to pull one up to give you an example here. These are developmental sequence for O&M by different ages and grades, so that if you're trying to work with a family or team to help them to understand what does my child need at any particular age, obviously that's going to be somewhat regionally specific or family specific, but this is a reasonable ballpark for what should a first grader do at any given age, second grade, third grade, so on and so forth. So lots of terrific resources that are available for evaluation. Jump back to the table of contents here. We've got some curriculum for the expanded core curriculum. This is some overlap from the original binder that we looked at. If you're concerned about your workload or your caseload, there's some resources here for that. And then we have other resources that are not necessarily O&M specific per se, but certainly helpful. So for instance, there's a bus driver planning tool that might help when you're working with the bus driver. There's some information here about our students with multiple disabilities. There's information if you're working with students who have monoculars, how to track their monocular use and how to continue to show improvement on that. And I'm from Texas School for the Blind and Visually Impaired, so every once in a while you'll see some things that are just Texas specific, and apologize for that. That's just a personal bias there, sorry. Sort again by most viewed. This particular binder, the remote and virtual O&M services, is something that just exploded in growth just because of necessity at the moment. And there's lots of resources here in terms of what you can provide remotely. I know that there are different things happening all over the country. We have some folks who are remote only. We have some that are hybrid. We have some that are back all face to face. And so some of these things may be helpful for you, some not helpful for you. But there's lots of different resources here for doing virtual activities. There are others who have made things, Diane Bronner, Sing Tu, there's Ting Su, sorry. There are so many resources that are available. Sometimes it can be a little bit overwhelming. There's information if you get into the depths of remote learning and you want to develop things like guidelines and standards. Fields like PT and OT and speech and language have been doing remote learning for years, and they have quite a developed set of background information in terms of their guidance and their policies about what we can do and what we shouldn't be doing in a remote setting. There are some examples of telepractice and how you can do things. For instance, if you're doing motor play or working with parents as facilitators through that remote instruction. So lots of different resources here for doing remote instruction. I'll work our way around through here again. And let's see. And Ron's got a note in here. Most of the resources are free, so no need to get the PO. You don't have to do any purchase orders. The resources here are available. Sometimes it's a link to a book, and the book, let's say it might be about CVI or it might be an evaluation. And so sometimes it's just connecting you with a resource that you might have to pay for. But many of these are videos from YouTube, different trainings. There are webinars, there are PDFs, evaluation guides, lots and lots of resources. For those of you that work with students who are deafblind or dual sensory loss, there are resources here that help you to work with the audiological team, to work with the teachers of deaf and hard of hearing. There are, and that's called Sound Travels, lots of different tools to help. Many times an audiologist is attempting to eliminate noise so that communication can occur, but as orientation mobility specialists, we use that noise to help learners and travelers be able to connect with their environment. So we work from opposite directions. And these resources are just to help you to be able to have helpful communication and get everyone on the team on the same page. There are categories here for students who are in more functional programs, who are just our beginning learners developmentally. They might be 21, but they're just still working on basic functional skills. And so they might be using calendar systems, tactile communication systems. They may not even have formal language yet. There are resources as at the most basic level of hand under hand as opposed to hand over hand, and other systems. And then we have for students who are in the academic category, we have some resources to help them to be able to transition into independent adult life. And then there are some other videos and things to help families be able to understand what might be happening, or teachers to understand that process. So lots and lots of different resources for individuals who are dual sensory loss. CVI is another area that lots of people have questions about. There continues to be just a wonderful contribution from the field, from experts, Dr. Christine Roman. There are other websites like Strategy to See that are just terrific resources. There's lots and lots of tools here, be it videos, documents, links to books, Diane Sheeline's information. And so this is an area that many times people have gone through their university training without receiving much information other than maybe hearing what CVI is. And we continue to learn more with medical science and doing some research. And so we begin to develop that body of knowledge. And so hopefully there's some resources here that would be helpful to folks. And early childhood. There are some folks who have infants and toddlers, and others that's not even part of their picture, but still resources abound. Those from New Mexico, Tanny Anthony, again, they're just terrific resources that are timeless. There are certainly other tools available. These are just places to get you started, so that if, let's say, you're not familiar with working with infants and toddlers and all of a sudden you receive one, this is a great place to go and have the information, at least to get you started, to open the door so that you can learn more about working with the infants and toddlers themselves, but also coaching the families on how they can work with their child and develop those positive relationships and positive activities that help the young person have those skills to be able to build on throughout life. And okay. There's lots and lots, excuse me, of technology that people have questions about. Again, areas that many of us were not exposed to in our university programs because it didn't exist. And now those things change daily. There's lots of accessible apps, GPS devices, so on and so forth. And again, these are just tools for doing that. So you may not be familiar with how to use the GPS, or to use a standalone tool like the Victor Reader Stream. There's information here about the devices. There's information about how to provide training. Some of them you have to do a little bit of a workaround. So just as an example, there's some guides here about learning how to use the GPS. I'm just going to pick one out here. If you are working with something new like the Victor Reader Trek, this is based in 2009 when it didn't exist. And so it might be that it's based on what was the Trekker Breeze or the original Trekker. But the lessons themselves about how to set a landmark, how to travel a route, how to rename a landmark, those activities are still the same. And so you can use these as a starting point for your training, helping someone to begin to use electronic travel aids, GPS devices, so on and so forth. There's information about iOS. There's information for those that are Apple iPhone or iPad users, as well as those who are Android users. And this is more focused on the GPS. There's another binder that has to do with things like using gestures to be able to interact with those devices in an accessible way. So I have an iPhone and I have an Android phone, but I forget between the two how to do certain activities, how to do certain gestures when using the accessibility mode of voiceover on the iPhone or talkback on the Android. And so having a resource of those is very helpful. And so let me see if I can jump back here. all the display of these icons of binders might look a little bit different on your computer, whether you're using your phone or a tablet or any particular browser. But basically, you'll have the binders. You can store them to a shelf if you create an account. Again, the basic account is free. There's another binder here that's on accessible maps. We have lots and lots of people who could benefit from tactile maps, but we're not born, to the best of my knowledge, knowing how to use tactile information. And certainly tactile map information is even another step in conceptual understanding beyond that. So there's resources here for helping a young person to develop the understanding of tactile information and then the understanding of map information. It can be as simple as which way is up. Well, up, if we raise our hand toward the ceiling, that's up, but in map space, up is toward the top of the page. Those are different concepts. So it's very helpful to be able to focus on those, to understand or to help the learner understand how to use those. There's information about creating different kinds of maps. So I'm going to move forward a little bit here. I'm just going to open a link or two. This is called a swell font. We have Swell Braille, and you can go in and download the font. It's free for creating Swell Braille so that you can make tactile maps. If you have a Fuser or PIAF, which is a pictures in a flash, or a tactile image enhancer, and using Swell paper, you can create these on your computer, print them out, and then emboss them or enhance them, running them through those Fuser systems. And the Braille allows individuals to have additional information. But there's also just a way of introducing beginning skills, whether it's through an APH system like Tactile Town, or just wiki sticks or pasta noodles glued on paper. Lots of different ways to make tactile maps and models. There's also less expensive things like a 3D pen. Lots and lots of resources here. So there's included information about finding those materials. If this is something that you want to do in a much more formal fashion, there's information about companies that will produce tactile maps. They're significantly more expensive, but sometimes there's a place and a purpose for that. There's information about auditory maps. For some learners, they may not have the tactile sensitivity from neuropathy to use a tactile map, and so we might move into another category like audio maps. Go back to the binder list here. And we talked a little bit about the O&M for families. This is primarily for our school age students, but it can be for adults as well. There are lots of resources to help families know how they can support O&M development, O&M growth. We get them for just a smidgen of their day, their week, their month, their year. Families have the greater influence and ability to reinforce the skills that we introduce. And so there's lots of resources here. Some of them are more game oriented. Lots of different ages represented, but ways, again, to keep the skills going. There's resources that are print, there's resources that are videos. So knowing the families, hopefully you have developed some rapport with them. And even if you haven't, there's ways that they can find things that are in print, things that are video format, things that are whatever form it is that works best for them to understand, to take in the information. I don't have resources for every language, but before I forget, I don't remember where it comes up in the list, but there is one binder that's specifically about O&M in Spanish. And so there's some resources there that will help with at least Spanish, and to help a family who is Spanish speaking only to be able to understand what O&M is and how they can support. Let's see, there's a question from Kim. Are there resources on here for one-on-one aids? Kim, I don't have any resources that are specifically for one-on-one aids, but what I do have, and I'm going to scan for a minute, is to look for, I've even forgotten the title of it. Here it is, O&M Basics for School Staff. And this is for individuals who are just beginning to interact with a student who is non-visual. And so there's information like glossary of O&M terms. There's information about canes and tips. So if they want to know what a cane is, what the tips are, there's information about basic skills like squaring off, hand trailing, purposeful movement. Some of these came from Parent Mobility, where they include a video of how those particular things happen. So just as an example, this is the Parent Mobility website, which is also listed in the Family Binder, but there are videos of how to do each skill. So hopefully you can introduce that skill during a lesson, but if they need a reminder in between, this is a terrific resource for the one-to-one aide to be able to go back and support that skill that you've introduced. There's lots of information about role release and what we would call an orientation mobility assistant. It used to be, we had a way to certify someone as that, but those things are becoming more prevalent, more important, certainly with remote instruction, working with parents and others from afar. But these are just, again, resources that hopefully will help you. Okay, moving through our list again here. There's O&M professional resources. These are just tools that as an O&M, you may find helpful, and I apologize, there's probably some folks who are on this webinar who are not O&Ms, and so you might find some resources in here, but these are, again, are targeted at our orientation mobility specialists. So there's information about contracting. There's usually a question that comes up perennially about how much do I charge? It's a very difficult question to answer because it's very region, sometimes even district or city specific. There's some helpful considerations for contracting there. There's information for those that have to do performance reviews. Many times our administrators, our supervisors are not aware of what orientation mobility is. So how would they grade or evaluate us? And this can give some guidance to them. There's information about private practice insurance, different resources for finding continuing education units for ACV, REP. There's professional resources from the terrific communication tool is the Orientation Mobility Listserv that you can sign on to. There are podcasts from different places, all sorts of different things that you as a professional may have interest in pursuing, whether you're a comms, an NOMC, or you're not certified. Hopefully you will find some resources here that would be helpful for you. And even some things about helping others to know what O&M is. And we have a question here, can a TVI use these LiveBinders? Anyone, any human that can work the computer can use these LiveBinders. They are meant to be free. They are meant to be shared. I'm going to put the link in again in the chat. And these are meant to help us as mobility specialists deliver services, to help travelers to develop skills any way that they can be used. Let's see. And if you have an account, you don't have to have an account to view them, but if you do have an account, you can kind of save a binder so you can go back and get to it easily. Over on the left-hand side, it has my shelves. So I can create a shelf of binders of things that are relevant. So I have information from some folks in Texas who are just prolific in writing binders, like Susie Tiggs, who has just a tremendous treasure trove of information about students who are deaf and deafblind. Lots of different resources and tools here. We're getting into some of the other technology here. This is a binder that is just for iOS. Again, there is another binder that is just for Android systems, but there are resources here from, just as an example, Hadley has wonderful instructional videos, though Hadley is targeted at primarily adults. And people of any age can use this. It might be a family member, it might be a middle school student. They have, I'm just gonna pick something here. Let's say that I want to go into, this is the low vision, but they also have a non-visual part. You can go into one of these, select a video, and it would give you a tutorial on how to use that particular feature of the iPhone or the Android device. There's a question from Karen Jones about how much does this cost. Karen, if you could specify what it is that you want to know about. The binders themselves are free to use, to look at. If you want to have a little bit fancier version of LiveBinders where you get more storage space, then you pay a fee that I've forgotten the number off the top of my head, but I'm going to say it's about $15 to $30 a year. But all of these things that I'm showing you, such as the videos from Hadley or YouTube or other places, all of these things are free. Occasionally, there will be a link to a book. So it used to be that AFB was producing many of our books for the field, but now APH is doing that. So it may take you to an APH site where you could purchase that book. There's no requirement that you purchase it from APH. You could look on eBay. You could look at, maybe you have a resource center in your area. Here in Texas, we have education service centers, and sometimes they have libraries of information for the field. But there are some things with a cost, but it's no cost to look at. And the things that are PDFs and videos, you can just access those at your, whenever you're ready, and in whatever way or how often you'd like. Location literacy is just a name for something I was trying to share with Paths to Literacy, to help people to understand that there are literacy tools that we use in O&M, ways for orientation mobility specialists to support and encourage literacy for our students. And so location literacy, understanding everything from cardinal directions to the information available on signage, is all part of our location literacy. So many times O&M is well minimized in comparison to those categories of education that come under standardized testing. And we can support those same concepts that are used in standardized testing. We have to be able to understand the geometry of an intersection. That's mathematical literacy. There's lots of different ways that we are using literacy in what we're doing. And these are just some tools to help to understand that, to reinforce those skills, but also to help our partners in general education to understand what we're doing and why it can be relevant, and how we can help each other to support students learning across their environments. And for our students who are either at the sensory motor level, or those who are just at the very beginning, early stages of development, communication, whether they are nonverbal. Dr. Van Dyke, Jan Van Dyke's name just popped out at me. So he just, his legacy is just amazing in helping us to understand how to work with students who are deafblind, students who are nonverbal. Lots and lots of resources. This was one of the hardest areas for me coming out of college, especially, to understand how to work with a student who couldn't tell me what they were feeling, who couldn't tell me what they wanted. I didn't quite know how to relate to them. So these are just things that have been helpful in finding ways to work with students who are most profoundly impacted by lots and lots of different challenges. And so hopefully you'll find some resources here. There's resources like Active Learning Space, which is a website dedicated to active learning materials and activities, lots and lots of different tools. And Ron's noting that the Seattle Sunboro link seems to be dead. Thank you, Ron. I will have to go back. I have not been very diligent in checking all the links. The Seattle Sombrero was a hat that was available that I think came from a guide dog school, is where I'd found it first, was the Seeing Eye or Guide Dogs for the Blind. I don't remember which, but terrific resources for being out in that cool, wet weather. Let's see. And Okay. We have other resources. Many times the challenges, frustrations, complaints that I hear about are, I'm not allowed to go off campus with my student. They won't let me take the bus. They won't let me do whatever, even though it's required by IDEA for school, home, and community. These are resources to help you advocate. These are resources to help you to go to your administrators, others on the team, to help them understand the importance and the necessity of why we do what we do, why it needs to go beyond the school building, and why we're preparing our students for what's to come, not necessarily just for their particular school at the moment, but we're preparing them for adult life. And so there's tools here from federal regulations. There's resources from state guidelines that states have compiled. There's also resources like ways that people have made things happen. So if it's a Word document, it won't show up. You have to download the document. You just do that by clicking on it, and it would then download to your computer. And then from your computer, let me just open that just to give you an idea. You click on it and it would open up for you. I probably have to share that in a different screen. I'm going to pause for a second, let that open. Okay, well, while Microsoft Word is still working, I'm going to continue here. There's different information about how, this is an example from the Texas School for the Blind, how they have made it possible for students to be able to travel into the community. Lots and lots of different ways that people have made it possible for students to have experiences in independence in the community, so that they have that moving forward, so that they have that for transitioning to work, transitioning to college, whatever it might be. Let's see, Ron says the inventory and tabs both include all these off-campus skills. Terrific. And so lots and lots of resources. And again, Ron's inventory is here, links to how to use his inventory. And thank you, Ron, for making that available for everyone. These, again, I didn't make these tools. I'm just sharing what's everybody has done to make resources available to help expand and grow the abilities of those that you work with. Moving along a little bit here, we've got, for those of you that are asked about bioptic driving, there's an open area of who handles this. And so the skills that a young person would use or an adult would use for bioptic driving have lots of overlap with what we do for low vision students who may not be drivers, but those skills can transfer. So it isn't for us to make the decision of who can drive and who can't drive, but we can certainly share these resources and help students to develop these skills, just as though we would for a student who wants to get a guide dog. They need to have their cane skills in preparation for doing that. For those that choose to be drivers, and that's possible for them, many of the skills that we're teaching in orientation mobility, whether it's understanding how traffic flows, understanding traffic controls, how to use low vision devices. And thank you, Becky, for the 5-minute warning. Lots of different resources here related to bioptic driving. And then there's some resources for orientation mobility specialists. Oh, I'll have to fix that link, sorry. So if it comes up as a 404, that's one I have to change. And if you find one and you can let me know, that's great, because then I can update it. But again, the monocular training tool, other different resources that can be used for helping people to develop the skills that they need to be able to transition into being a bioptic driver. Okay, getting down to the wire here. Oh. Thank you for your patience as I continue to resort some Texas specific things. Texas is the only state that I know of at the moment that has a legal requirement that students who are blind and visually impaired receive instruction in the expanded core curriculum. But there's some resources there if you'd like to advocate for that in your state. technology options for O&M is just kind of a fun whirlwind of adaptive equipment that we have available now. Everything from the We Walk cane to belts that tell you where north is, the haptic footwear that vibrates under your foot. Many of these things are far more expensive than many of our travelers can afford. And there's only so many of our travelers that have the ability to attend to both the information from their cane as well as to an electronic device. These aren't necessarily appropriate for every traveler, but we do occasionally have some travelers who are just really advanced and can not only pay attention to what their cane is telling them and their ears are telling them, but also to additional input that might come from any other part of their body, such as a wearable, but also to provide additional input from their smartphone. So this can be a fun breeze through, and there's also some ways, if you can't afford something, to make your own sonic device. So that if you want to make your own laser cane, there's ways to do that now with pieces and parts that you can order online, and people have made videos on how to do it. Okay, we got about 2 more minutes, so if anybody has a question, please throw it in that chat. And let's see. There are resources for social distancing so that when you come back and you're ready to provide that instruction, how can you effectively do that? If you're asked to do this for your school, there are resources that I just was tickled pink to. This came out at the beginning, or relative beginning of our pandemic. This is something that came from the UK, but it's a terrific look at how do we make it safe for people to come back to our buildings? How do we make it safe to have everyone return to as much of life as usual that we can do? I've got one minute left. You can peruse the binders anytime. They're here, they're free. And I encourage you to use the LiveBinder system to share resources with others. Thanks for everyone's contributions today in the chat. That was very helpful. And thank you for all your kindness. And I hope that the rest of the training goes great for everyone. I think that's going to do it, so we can make sure that we have time to get to our next presenter. So Miss Deanna has a chance. Thank you very much, everyone. Have a great day.
All right. There we go. Nope. There. Thank you, Chris. And just watch your email in the next couple of days, because you should be getting a special thank you from us.
Oh, okay. Thank you very much, Becky.
We're just trying to make people aware and make sure it doesn't go to your spam or something. So the ending code is resources with an S. So resources is the ending code. All right, so we are going to move on now to the next presentation, and it is going to be with Deanna Austin, who is from the VA Medical Center, and she's going to give us the update on the current VA services. And so I don't screw it up again, the beginning code is update. Update is the beginning code. So Deanna has worked for over 11 years at the VA Medical Center in Indianapolis as the Visual Impairment Services Team, or VIST coordinator. Deanna's duties include being a care coordinator to over 600 veterans who have functional issues related to vision loss, coordinating a monthly support group, and providing community education regarding issues related to vision loss. Deanna has over 25 years experience of working with individuals who are blind or visually impaired. She's a certified vision rehabilitation therapist and a licensed social worker. She's currently on the state board of the American Council for the Blind and a member of the Association of Vision Rehabilitation Therapists. She's married, has 2 stepchildren, 2 grandchildren, although she's not old enough for that, but she loves cats and dogs, traveling and reading. So welcome, Deanna.
Thank you. All right, thank you very much. So I'm glad to be here, and I know that we have people from all over that are participating. So I thought what I would do is present in general about the VA healthcare system and about blind rehab services within the VA. So thank you for joining me today. Just one moment here. I'm going to try to get where the, all right, I wasn't quite able to get what I wanted with the chat box. So I will continue on, and Becky can know that I'm not able to view the chat box like I was for Chris's presentation. All right, so Becky did introduce me. I've been at the VA since 2009. I myself was born with vision loss, and I've been a bioptic driver for over 24 years. So certainly if anyone has questions about bioptics, I'm happy to answer that as well. So our objectives today, we're going to talk about who's eligible for VA healthcare, what is included when a veteran is eligible for VA, how do you as individuals refer a veteran to the VA, or how do they enroll, how does a veteran enroll, and then what services are available to veterans with vision loss. The VA, the Department of Veteran Affairs, became a cabinet level position in 1988. And there are 3 areas of service. One is the National Cemetery Administration, and that is the area that does burials and memorials. Every state is going to have some VA cemeteries. A veteran was telling me about Crown Hill and here in Indianapolis. So this is where veterans or families have burial and memorial benefits. There's the Veterans Health Administration. That's what we're going to be talking about today. That'll be the focus of my presentation. And there's the Veterans Benefits Administration. The Benefits Administration are things like VA home loans that a lot of you, I'm assuming, will be familiar with, or the GI Bill. And again, keep in mind that I know some of you may work with school-age children, but this presentation is going to give you some general knowledge about the VA so that if you have parents that or grandparents that have that hat on that tells you that they're a veteran, that you could ask a couple of questions to see if they wouldn't be interested in pursuing their VA benefits if appropriate. So also VA life insurance, the Veterans Readiness and Employment Services, which used to be called VOC Rehab, but it's Veterans Readiness and Employment. That is for our service-connected veterans who are looking at employment. So the VA actually has their own VR or the Veterans Readiness. And then compensation and pension. Compensation and pension is monies that the VA pays to veterans or widows of veterans that either compensate a veteran for an injury that they obtained or manifested itself after the service. A really common one with that is hearing loss. Of course, there are some veterans that were blinded in the service, so veterans with vision loss, are veterans that are amputees, veterans who have post-traumatic stress, veterans who have scars, just a variety of lots and lots of things that a veteran
passages. I think they're 1 passage.
All right, pension. Pension is for our veterans who served during a period of war that have limited income. And a pension can vary in the amount, and it's something that not always veterans are aware of is out there for them. So VA healthcare enrollment, at the end of the day, the best guidance I can give is if a veteran served in the military, if they're in active duty. Some veterans were in the Guards and were called into active duty. The best thing that they could do is to see if they're eligible for VA healthcare. Now, not all veterans will be eligible for VA healthcare. That's just how it is. Not every veteran is eligible for VA. And a good example I give is I have two brothers that both served in the Army in the 1980s, which was during peacetime. They both have gone on to have careers and make a decent wage. They have no ailments or injuries from being in the service. So if they went to their local VA or went online and tried to enroll, they're going to be denied enrollment. Now they can still do that, but they're going to be told that they're not eligible at this time. Now it could be that as they age, or if Congress makes some changes, it could be that they would become eligible. But that's my example that I use. So we encourage all veterans to apply to determine their eligibility. And the eligibility is going to depend on how they were discharged. Most veterans have honorable discharge. There's different discharge levels, and they must have an other than dishonorable. So if a veteran has a dishonorable discharge, then they are not going to be eligible for VA health care. But that's something that they would take up with their enrollment office. For a lot of veterans, the VA is based on income. The VA no longer looks at assets, which is nice. So the veteran could have a lot of money in the bank or in savings, and the VA is not going to look at that. They're going to look at their income from the previous year, and they're going to allow the veteran to deduct medical expenses. Enrollment could also be disability. It could also be how long they were in the service, whether they are a prisoner of war, Purple Heart recipient. Our Vietnam veterans that have been in Vietnam are going to be eligible for enrollment, and not every Vietnam veteran realizes that. So they tried years ago to enroll and they were denied, and they think that's it. So they may need to be encouraged to apply again, or if their health changes or their circumstances change, they may not have been eligible, but they may be. Camp Lejeune had some water contamination that the VA has documented for 30 years during the 50s to the 80s, I believe it is. So that group of veterans are eligible for enrollment. So the VA changes kind of the enrollment. So again, just encouraging them to enroll. And we'll talk about how to enroll in a minute. When the veteran does enroll, they're going to receive a welcome to my VA phone call. They're going to get a booklet. They're going to get a letter. And then the VA also has a health identification card. So they have an ID card that they can use. And sometimes that ID card is helpful. Like if they want to go to Lowe's and get a 10% discount, they may need to show that card. All right. So one major piece of information to know is veterans who are considered to be severely disabled, which includes our veterans who are legally blind, may be eligible for VA based on their disability. They're going to have to meet other requirements like their time in the service, their discharge status of honorable or other than honorable, but if they are severely disabled, they may also be eligible for VA. I have a couple examples of that. So I had an uncle who lived in Virginia and worked in the shipyards. He was a Marine, was in the service, back in the 50s. Got out, lived his life, no problems, never went to the VA. But then in time, he retired from the shipyard, which is a nice retirement. But in time, he became bedridden. And he was eligible for VA no longer based on his income, which would not have made him eligible, but based on the fact that he was severely disabled. So he was able to get some VA benefits near the end of his life. For veterans who are legally blind, the VA considers legal blindness to be a catastrophic disability. Not my favorite word, but I let veterans know that. So their legal blindness could mean that they are eligible. They would not be eligible regularly, but if they are in contact with their visual impairment coordinator, if they submit proof of the legal blindness status, the I notes, those will be reviewed by the VA. And then the veteran may be eligible for VA healthcare. And that's very important as we're all working with people with vision loss. So a veteran can enroll in person at their local VA facility. That's usually open Monday through Friday from 8 to 4, that they can go there. They are going to need to bring some paperwork, their ID, their discharge papers, their insurance, but they can enroll in person. They can enroll over the phone. And I recently just called that number verifying that that's correct, that they can enroll by phone, meaning the VA staff will help them take the information and then most likely send a packet of what else the veteran needs to complete. They can complete it by mail and mail that in. They can do online. Now, going to va.gov is not going to be the right place for enrollment, but if a veteran looks around that website, they will find information on how to enroll and then click on the links, and then they can begin the enrollment process. And when a veteran does enroll, they will be offered a patient-aligned care team. I'm going to do a few more slides and then I'm going to pause for some questions about the VA in general before I move into blind rehab services. So what's included in VA benefits? So when a veteran is eligible, what does that mean? What are they going to be getting? Well, first, we encourage them to have a primary care team. Now, they may already see a doctor outside the VA, and that is fine, no problem. But in the VA, the primary care team is the hub of other benefits. So if they wanted to see a cardiologist, they're going to have primary care refer them to cardiology. If they want to see a rheumatologist, they're going to have primary care for them to go to a rheumatologist. So I just encourage all of my veterans to have primary care. And I have a lot of veterans that have both outside VA primary care and within the VA. I have veterans that have nothing but the VA, and I have some veterans that just don't want primary care. But I remind them when I meet with them that if they were to need in-home services or help with their medications or help with a bath, they're going to need to have primary care. So why not get that when they are well enough to have that appointment and not wait until they're in a bad spot of needing the care only to not have any primary care. The VA has a team, we call it PACT, Patient Aligned Care Team. We have the primary care provider, we have a pharmacist, a nurse, nutritionist, psychologist, social worker, medical support assistant. So they have a nice team that's available to them. The VA also has specialty clinics. The eye clinic is a specialty clinic. And audiology, podiatry, which is for the feet, ear, nose, and throat, all of your specialties, urology, dermatology, cardiology. We have physical therapy and occupational therapy. So for example, I had someone that was said they weren't able to dress themselves. And I was asking them if that had to do with their vision loss or what was hindering them from dressing. And the response was that they couldn't button very well, that their wife had to help them button. So I suggested that they go through their primary care for an occupational therapy consult who could give them probably that button assist tool that could help them with buttoning their shirt. We have a weight management program called MOVE, where we help veterans with encouraging weight loss, and we have programs and guidance and things to help with that. Blind rehab services is a specialty. So we have lots of specialties. We also have a caregiver support program. This is another thing that's recently changed. So we have a program that specifically helps the caregivers of all veterans, but we have some special programs under there where some caregivers are paid to care for the veteran, or the caregiver gets health insurance because they're busy caring for the veteran. That special program is available for our veterans that served prior to 1975. So that's going to include all of our World War II, Korea, and all of our Vietnam veterans. They do have to meet some guidelines. They have to have had a service-connected condition. That means they were injured in the service or that they have a disability from the service. The other years of that is any veteran after 2001. So this is expanded just recently, just a few weeks ago, and that's our caregiver program. We have mental health services, substance abuse, homeless programs for our women veterans. I've heard that they at times get lost in the shuffle. They don't realize that they have VA benefits. So we do have specific coordinators for our women veterans. We have a minority veteran coordinator. We have a coordinator for military sexual trauma. Unfortunately, some veterans had a military sexual event that occurred when they were in the service. And there is a coordinator that helps those veterans to make sure they get what they need, make sure they get the mental health service they need and the VA medical services that they need, and have someone to talk with. We also we do whole health, looking at the veteran's entire health, yoga, Tai Chi, pain management, art therapy. These things vary at the medical centers. So we just have a lot that goes on outside of just getting a physical. And as I mentioned, veterans are encouraged to have primary care. In my world, if a veteran wants a talking blood pressure meter or a talking scale or a talking glucometer, that's going to come mostly through the primary care clinic. Maybe I want a veteran to have some memory testing or a neuropsych evaluation. That comes from primary care. Social work, which helps our veterans who are older, who need in-home care, help with their medications, help with a bath, a break for the caregiver. And to emphasize these points, a lot of veterans don't realize this, but any veteran enrolled in VA healthcare can have an eye exam or get eyeglasses. Now, we might have a limit on how many pairs of eyeglasses, but veterans can have an eye exam and eyeglasses. Any veteran enrolled in VA healthcare can have an audio exam, a hearing exam, and hearing aids. We also have My Healthy Vet. That's an online program that a veteran can communicate to their providers via secure message, which is an email to their providers or myself. So they can email me and let me know different things that are going on or make a request. They can email their primary care and ask for a prescription to be refilled. They can, whoever they want to get a hold of, they can communicate with and ask questions. Or, I was supposed to be scheduled in the eye clinic in 3 weeks, but I don't see anything, can you help me get this scheduled? We also have VA Video Connect, and we've had VA Video Connect for several years. This is where we can have visits with our veterans over the computer. Now, when COVID hit, that just boomed. But we have goals of how often we use our video system. And I have totally blind veterans that I've had VA Video Connect appointments with. I have a lot of veterans with low vision that I've had appointments with. If I have vendors that go out to the home, they're helping the veteran know to be able to be empowered to use Video Connect. A lot of people think, oh, they wouldn't use that, they can't see, or they're blind, so they're not going to use video, but that is not true. Again, even my totally blind veterans, I'm encouraging them to use VA Video Connect because it's a way for the provider to have that meeting over video, which is considered in person. So it's over video that you're having a session and can get information, more information than you would get by having a phone visit. All right. Becky, do I have any questions or anything that's come across at this point?
No.
Okay, thank you. All right, and I'm sorry, I had it working when we practiced, but I'm not sure, so I won't spend the time figuring it out at this point. Let's talk about blind rehab services. So VA has integrated blind rehabilitation or vision rehabilitation directly into the healthcare system, which I think is wonderful. We're the only healthcare system in the United States that has done that. And it sure is nice. When I first started in the VA in 2009, I thought, well, this is kind of odd. I don't really fit here. I'm just kind of this extra thing that is available. And in time, I've evolved myself to look at it a completely different way and understand that it's just built right in. Now, that doesn't mean that people don't fall through cracks by any means. We have veterans that many do, you know, they go to the eye clinic and they have just no idea that these services are available. And I'll have them say, I wish they would have known about it sooner. So blind rehabilitation, we're our own service, meaning like primary care is a service, or the eye clinic is a service, or physical medicine rehab, OTPT, they're a unit of the VA. Blind rehabilitation is a service. We have multiple level staff that provide services to the blind and visually impaired. The care coordinator is called the VIST coordinator, or Visual Impairment Services Team Coordinator. We have outpatient specialists. We might have one on the call or on our meeting today. I'm not sure if we do or not. We have a continuum of care. So we have low vision clinics. We have an outpatient low vision, or we have multiple outpatient low vision clinics. We have our inpatient blind rehab centers, and we have consultants. So we have consultants that help us as blind rehab staff make sure we're doing what we're supposed to. They're not our direct supervisor, but they're giving us guidance and helping us if we have issues to problem solve. And they play an administrative role, and they're wonderful. Our central office blind rehab does a fantastic job. They're very professional, on board, whip you into shape. So they do a great job. So the VIST coordinators, that would be myself. We're care coordinators who coordinate services for all veterans with any type of documented vision loss and a functional limitation. This can include our active duty service members. So maybe a veteran who's just recently been wounded, or maybe discharged, or not yet discharged, but have vision loss. But our goal is to identify new veterans with vision loss. So find those veterans who state they can't see well, you know, help them with the enrollment process. I've met veterans at the front door of the VA. I've walked them through getting enrolled. I've partnered with Enrollment to make sure that they're properly enrolled. And then we do an assessment of how are they doing with their VA benefits, helping them understand that. VA has a lot of benefits. So if a veteran is service connected for vision loss, making sure they get all of those benefits and all of their blind rehab benefits as well. We do an annual review. We offer that to our veterans of, hey, would you like to have a meeting? Would you like to review what's been happening? Do you have any equipment that isn't working or that needs replaced, or you need something new? We provide for all the blind rehab services that a veteran gets. So if a veteran gets training at a locally, we're going to coordinate that or report that, you know, track that. If a veteran goes to a low vision clinic in the community, for example, in my area in Indianapolis, I send veterans maybe to Dayton or Cincinnati, Detroit, Saginaw, Michigan. So I'm referring them and tracking that. So if a veteran goes to our inpatient blind rehab center, I'm sending that referral in and doing all the testing that's necessary to make sure that all the ducks are in a row so that I can place the referral. I also, or VIS coordinators, have a monthly support group meeting. A lot of us have meetings. A lot of us have changed those meetings to phone because of COVID. We do newsletters, keeping veterans informed. We also provide education like this presentation, and also within the VA. I know when I started, I certainly thought every employee knew the VIS coordinator. The gentleman had been at the Indy VA for 26 years. I just thought everybody knew him. And I realized that probably about half of the employees, which is disheartening and unfortunate, but the reality is probably only about half are aware of blind rehab services at all in their own VA medical center. So it's important for us coordinators to communicate and educate to the VA staff of these services. And then we might be involved in some special programs like adaptive sports, or I've mentored other VIS coordinators and helped with administrative duties about blind rehab services. The VIST coordinators, let me just go back to that. There should be a VIST coordinator at every VA hospital at the main hospital. So there should be a coordinator there. And they could be part-time, full-time. Where they come from education-wise could vary. They could be a VR counselor, they could be a blind rehab specialist, a social worker, an occupational therapist. So they come from a certain discipline as long as they're licensed in that discipline and they know that they're going to be working with the blind and visually impaired and care coordinating. So many of us come from different disciplines and are VIS coordinators. Then we have our blind rehab outpatient specialists. So Indiana has access to 2 or 3 of these outpatient specialists. There's one in Louisville that sees the Southern Indiana veterans. There's Ben Fisher in Fort Wayne that sees the Fort Wayne, Marion, the whole northeast area of Indiana, and him and I have done some partnering. And then there's a outpatient specialist through the Hines VA that will go out sometime to the Calumet region, the Crown Point area in northwest Indiana. So the outpatient specialists, they're multi-skilled blind rehab professionals. They provide service in the home. They could offer before a veteran goes to inpatient training or other training. They may train veterans who cannot attend, family members, and not every VA has an outpatient specialist. Our low vision services. So low vision is available at all VAs on some level. Basic low vision should be available at every VA, and it's going to look different at every VA. The Indianapolis VA has Dr. McConaughey. She is at our medical center 1.5 days a week. She does low vision and she does neuro, which is working with our veterans with brain injuries, migraines, concussions, and strokes. She is retiring at the end of the year. So I want people to be aware of that she is retiring. So if you've worked with her and if you haven't congratulated her on her retirement, my email is going to be on the last slide. Send me an email and I'll get you her email so you can wish her well in her full retirement. So she's been working in the field for well over 30 years. So the basic low vision is going to look different, but it's definitely an optometric exam with or without dilation. It's getting glasses. The low vision optometrist is going to evaluate for binoculars, magnifiers, CCTVs, glare, filters, prisms. Maybe the person has some neurological issues of tracking and needs to be seen by an occupational therapist or some neuro exam. So it's a comprehensive exam that is going to hone in what a person needs who has low vision to continue to be successful. Then the continuum of care in blind rehab means we have other clinics. So we have a clinic with more staff, there's multiple ones of these all over the United States. Again, the one close here is Detroit and Cincinnati. That means they're going to have more employees there that are going to be doing more in blind rehab. So instead of maybe 1 or 2 employees, they're going to have maybe 3 or 4 full-time or part-time employees. Saginaw is a little bit more advanced in Dayton, so they have more staff. And they're going to be able to do more training. So they might have a full-time mobility specialist, O&M specialist on staff where they could meet with them for several days and do mobility. Then we have what's called our visor clinics, which is our outpatient clinic. The one I partner with is Battle Creek, and a veteran can stay there. Of course, now with COVID, that looks a little different. We haven't quite advanced to persons staying there yet, but they could go and get full training for up to 10 days. And this training has gone virtual. So I've had several partnerships with our Battle Creek VA doing virtual sessions with veterans, teaching them how to use different things. And then if you're not familiar, the VA has inpatient blind rehab centers, and this is really where blind rehab got its beginning. So we've had inpatient blind rehab centers for over 70 years. We're probably going on about 72 years the Hines VA has had inpatient. We have 13 centers around the United States, including San Juan, Puerto Rico. What these centers look like varies per center. For example, I partner a lot with the Hines VA. That's a 34-bed unit, so 34 veterans will go there. I also partner with Cleveland, and that's a 14 or 15-bed unit. So it's going to look a lot different. But the core is the same, where the veteran is leaving home, staying at a VA hospital, going to classes Monday through Friday, 1 hour in mobility, 1 hour in living skills or vision rehab therapy, 1 hour in technology, 1 hour in manual skills, the use of the hands, full-time rec therapists, social workers. So this is just, it cannot be replaced, the training. Unfortunately, a lot of the inpatient units have been closed because of COVID. I'll talk about that in a minute. And they're doing virtual training. So they're partnering with all the VAs and doing virtual training. The veteran could stay there anywhere from 4 to 6 weeks. I've had veterans there as little as 1 week or a few days. I've had veterans as long as 10 or 12 weeks. So it really varies by the veteran. And this is a slide that just helps kind of put it all into one about our continuum of care, starting with basic low vision, and then we have different clinics that are more advanced, and then we have our inpatient. And then this is example of prosthetic devices. So in the VA is very generous to our veterans with vision loss. So a prosthetic device, which if you're at all familiar with that word, you might equate it to a prosthetic eye or a prosthetic limb, like an arm and a leg. But the prosthetic department does everything and anything related to what a person might need. So CPAP supplies, wheelchairs, hospital beds, and in blind rehab service, it can include, watches, bold line paper, bold pens, timers, long white canes, talking tape measures, saw stops, anything and everything, magnifiers, computers, iPads, iPhones, OrCams, head-mounted devices, Google Homes, Amazon Echo devices, Apple TVs. Now, not every veteran gets all of this. They get what they need and what their need is, what they have goals for, and what they're evaluated for. And all of us that work with people who are blind or visually impaired know that even a talking watch needs some evaluation. Can they hear the watch? Are they going to be able to push the buttons? Do they need a low vision watch? Do they need a certain band? Do they need a tactile watch? So, even just as what most people think is simply just, giving them a watch, or, they can get their pens at the dollar store. Well, do they bleed through the other side? Just these little things can make the big difference. So it can be as little as a talking watch or bump dots all the way up to computer systems. Now, to respond to COVID. So COVID hit in my little world. I had a support group meeting on March 13th, and I thought, you know what? We've had that first case. I happened to be at a meeting on March 6th when Indiana had their first case. I began to think, I don't think getting a meeting in person in a small room that we're packed in is going to be a good idea. So I quickly changed my meeting over to phone, and we've met phone for my support group meeting ever since. But on Friday the 13th, in 2020, Blind Rehab Service announced that it would begin discharging all patients who are participating in inpatient blind rehab. I had 2 or 3 veterans that were at the Hines VA that were going to be discharged and sent home. I had one there probably in late March. So I think everyone was discharged by beginning of April. An initiative that blind rehab in the VA did is they began calling every single veteran that had been at the blind rehab centers within the last 18 months and began asking them questions. Did they have access to getting what they need? Was there anything that they needed? You know, how could the VA help during this time? So that was great that several of my veterans received phone calls. Then we began to do virtual trainings. The VA relaxed how we could meet with veterans virtually. So they said we can meet with patients by Facebook, by Zoom, other means of meeting. They have a list that they've provided. But we began doing virtual visits. And so we began to meet with veterans in a virtual way instead of face-to-face. The outpatient specialists, they were also really, you know, closed down with who they could see. But then, you know, hey, if we have a veteran that needs to be able to get food or needs to be able to figure out how to get around their home, then the outpatient specialist would go out with their gown and gloves and mask and all that PPE and provide the visit. And now what that looks like varies per station on what the protocol is for these people going out in the home. Eventually in time, the local level, like I was able to have contractors go back out. So then it was kind of up to the contractor with how they felt about going out and what that would look like going into someone's home. Now the blind rehab centers have begun to open. Long Beach and Tucson have begun to open. The Hines VA is going to be opening starting next week, but it's going to look different and the veterans are going to have to go through some strict protocol to go. So it has changed things. So as I summarize, just to remind you, encourage a veteran to enroll in VA healthcare. Don't make guarantees that they're eligible, but just say, oh, hey, you were in the service, or oh, you were in the guards, but you were called up to active duty. You might want to see if you're eligible for VA. Keep in mind, please, 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 that if a veteran is legally blind, that it's best if they are in contact with their VIST coordinator so that that coordinator can help make sure they don't get rejected in the VA. And the list of Indiana coordinators is on the sched for this conference. And you can also just Google VA VIST coordinators and you will get taken to the blind rehab link that you can see the whole list of VIST coordinators around the United States. And there's multiple programs for veterans, not just seeing a doctor, not just having an eye exam. So again, we talked about the weight loss programs, the whole health, you know, music therapy, art therapy, just different programs that are available at different VAs. Blind rehab service is available at all the VAs, and what it looks like is going to be different at every VA. So a veteran in Florida that received ABC, when they move to Indiana, it could look different. It could be better. It could be, you know, not as much services. So it's going to look different. And the veteran can participate in services. And then all veterans with any type of vision loss receive lifetime case coordination from that VIST coordinator. And then here's some websites and phone numbers as we close. So the general VA, there's the number for the Veterans Benefits and the National Cemetery, the hospital number, the blind rehab. We have a website that anyone can go to and look around. My point of contact, if you have questions for my national consultant, that's Ella Hart. And then there's my point of contact as well, Deanna Austin. My phone number is 317-988-2576. 317-988-2576. And my email is Deanna, D-E-A, N as in Nancy, N as in Nancy, A, .Austin, AUSTIN, @va.gov. All right, any questions? And I'll stop sharing my screen and then I can probably get back to that chat box.
All right, so there was one that said regarding the video, does the VA provide the vet with the resource to receive the video? And how often do they have to have a video conference call before the device is requested to be returned?
So I'm going to give kind of a general answer. So there's been some partnerships lately where the VA, of course, with COVID is expanding our video capability. So the VA does have VA issued iPads that any veteran can get if they have a certain medical need and need to meet with the provider a certain scheduled time. So for example, I have a veteran that has one of those iPads, and he has to have a regularly scheduled visit with the provider. If he doesn't, the VA is going to ask for that iPad to be returned. And the iPad does not do what your iPad does, my iPad. It only does VA things. It only does maybe email. It's very restricted in what it can do. Now, a veteran can use their own equipment. So veterans can use, their own smartphones, their own computers. The computers have to have a camera. They have to have an email, an Android device. They can use an Android phone, iPhones. The iPhone, iOS devices do require an app. So they do have to have an app. Android does not require the app. And we're enhancing our partnership. So let's say a veteran lives in rural Indiana, the iPad that they might get from the VA, from just general VA, is going to have the cellular connection. And there isn't going to be a charge, like T-Mobile and Verizon, I believe, have a partnership with the VA where there's no charge for video visits. Now, VA Blind Rehab also provides devices. So if a veteran has a computer that VA Blind Rehab has provided, then we're trying to make where they can be able to do that visit. If you're familiar with a veteran, especially in my area, that has a computer that wants to do a visit but can't because the computer doesn't have a camera, then let me know and we can see what we can do to get a webcam for the veteran so they can begin to do video visits, and also be for the veteran to be able to promote that they can do video visits. So, oh, the iOS no longer requires the VVC app. That would be nice. I haven't heard that yet, but if that's true, that's a bros, so that's wonderful. So I'll be glad for that. That'll save a step. Any other questions? Well, thank you to everyone today. I want to thank my local partners. I know, Becky Smallwood is one of my local partners that provides services to the blind veterans, Bosma Enterprises, Crossroads, the Will Center, Danny Wayne at the Will Center. I certainly rely very heavily on my community partners and just greatly appreciate. And Blind Rehab, certainly the other VIS coordinators in Indiana, and just the outpatient specialists and the blind rehab specialists. It's really a very great field. And we all know that. So we're in a good field to work with. So, and thank you to AER for having me present. I appreciate all their help as well. Thank you.
Well, thank you, Deanna. We appreciated you being here with us today. So again, by now you should be used to it. If you want the CEUs, do your evaluation, the closing code is services. And Carol's already put it in the chat room for you. So it is services.